Thank you for joining us. Health is a subject of importance to just about everyone. And with us today are two pioneers in the pursuit of longevity, Dr. Dipnarine Maharaj, Director of the South Florida Bone Marrow Stem Cell Transplant Institute, and another pioneer in anti-aging research, the co-founder of the Life Extension Foundation, Mr. Bill Faloon. They were recently interviewed by Cheryl Martin, the owner of Gardens Wellness Center, my co-host and producer, and we'll learn more about their research following these messages.
Life Extension Foundation was established in 1977 and has grown to become the world's largest consumer-based anti-aging organization. Life-saving achievements taken for granted today were pioneered by Life Extension Foundation decades ago. Life Extension is currently funding $10 million a year in research on significantly extending a healthy human lifespan. Diseases that once plagued humanity have largely been eradicated by scientific innovation. 3 leading causes of death in 1900 compared with how people die today. Smallpox killed millions before it was eliminated in 1979. Life Extension funds research to fight biological aging so that it also will become a relic of the past. Log on to lifeextensionfoundation.org.
At Gardens Wellness Center, we provide a full menu of holistic services under one roof. Services to heal the body through chiropractic care, acupuncture, and colon hydrotherapy, and services to heal the mind through hypnotherapy, neurolinguistic programming, and life coaching. We practice functional and Chinese medicine and offer a full herbal pharmacy. Visit us today and take charge of your health.
Rejuvenate your skin from the inside out and the outside in. With 98.6% naturally derived ingredients, you experience vibrant skin from day one. Introducing the Alavita Regenerating Trio, a moisturizing and anti-aging solution. These 3 innovative products reduce the appearance of fine lines and wrinkles. Alavita, a beautiful merging of nature and science. Learn more online today.
When I was young, it seemed that life was so wonderful. A miracle, oh it was beautiful, magical. And then they showed me a world where I could be so dependable. Oh, intellectual, cynical.
Find magic again. Sprout by HP. With Intel RealSense technology inside, now you can bend the rules of creativity outside.
With us now we have Dr. Maharaj and Bill Faloon. Thank you both for joining us.
Thank you.
Bill, tell us a bit about the presentation that you had this evening.
What we presented tonight is the first opportunity that we know of to biologically reverse aging in elderly humans. This is something that's been sought after for centuries, but medically it has not become available until very recent years.
And what kind of things would slowing aging help?
We're talking about reversing it. We can slow aging right now via a number of different methodologies. We can slow it down, but that's not really good enough, because once you reach a certain point, so many degenerative illnesses have manifested, it doesn't really do much good. We need to reverse biological aging, and that was the premise of tonight's discussion.
And how would that help with aging and disease?
Well, I think that essentially, what's our goal? Our goal is actually to have a good quality of life without disease. And there are people who are able to achieve that. And when we study these individuals, we see that a critical component is actually that the natural process which occurs in the majority of people, which is aging of the immune system. These people tend to be protected from it. And also, as a result of the preservation of the immune system, inflammation, which is the underlying root cause of all diseases, is actually being well controlled. So these individuals have the internal environment of a younger person, biologically. So the goal here is, since we can measure this for each individual, is to identify those people who are aging faster and then utilize the technology we have. And in the work that we're doing is utilizing their own stem cells to be able to improve their immune system and therefore decrease the inflammation and therefore the disease processes. For those individuals in whom it's not possible to do so, the study protocol we're designing and which we're we will be seeking approval for would be to actually use the factors present in the blood of young people to be able to achieve that goal.
So Bill, you're already into groundbreaking technology with rats and so forth on these studies with stem cells by taking the younger cells and putting them into the older person. Tell us a little bit about that.
Well, the whole premise is dozens of peer-reviewed published studies have demonstrated that when old animals are given young blood, the aging process systemically is reversed. Those older animals grow younger. We believe the same mechanism can be applied to elderly humans. It's not as simple in people as it is in lower species. It's not as simple, but it can be done, and that's what the research is premised on. Taking stem cell mobilized plasma components from healthy 21-year-old individuals and infusing those into older people, and then measuring how much age reversal we are able to induce.
But you're also seeing disease reversal as well, correct?
It goes hand in hand. As we grow older, all of the degenerative diseases increase as far as risk and incidence. They happen as a part of normal aging. By reversing biological aging, we believe we will be protecting these individuals against malignancies, vascular disorders, organ failure, and immune senescence, the ultimate killer. If you avoid cancer and heart disease, at some point your immune system gives out and you die of pneumonia or some other opportunistic infection.
What about people that already have disease?
There's a tremendous opportunity for those individuals to utilize an enhanced immune system to first suppress the inflammation, because inflammation is the fundamental cause of most of the degenerative diseases of aging. So we can suppress inflammation and do it in a safe way, and then build up immune surveillance so that if they have a malignancy, and maybe it's been effectively treated, but we don't know if all those cells have been eradicated. If you enhance immune function, you provide an opportunity to keep that cancer from ever coming back.
Dr. Maharaj, I saw an article about you that suggested that you might actually be moving towards the cure for cancer. How does that fit in with this discussion?
Well, again, I think that the cancer, when patients have cancer and they recover from the cancer and they're long-term survivors, essentially the evidence we have suggests that they have reinstated immune surveillance. That is and it is essentially immune surveillance that prevents someone from getting cancer. So cancer, in my opinion, is very curable. We have many patients who we've treated over the years who are long-term survivors who were basically told that their cancer was progressing, that the chemotherapy or radiation or the treatments as a standard of care were not working. And in these patients, using immunotherapy, using stem cells, we were able to reinstate immune surveillance and allow them to have long-term disease-free survival. So if we can do the same thing for all different types of cancers, then we will be able to cure more patients with cancer.
And you're also finding success in other diseases as well, like diabetes and Parkinson's. What about ALS?
Again, all of these diseases, the background is basically accelerated cell death occurring on a backbone of inflammation. So to be able to make an impact on them, what we've got to do is be able to identify the root causes of what's accelerating the death of the cells, and inflammation happens to be a big part of that. So if we look at the type of inflammation that occurs in neuroinflammatory disorders, of which ALS is one form. The components of the immune system which are activated are called microglial cells. And so if these cells, which are producing inflammatory cytokines like tumor necrosis factor, IL-1, IL-6, which is actually causing the nerve damage, if we can suppress the activation of these cells, we can then suppress the nerve damage, and then we can get recovery.
Now, life extension has been at the core of all of this research. How did it all begin?
Life Extension was founded in 1980 as far as attracting members. We actually existed a while before 1980, but the idea was to raise money to fund physician scientists like Dr. Maharaj, who's got the technology and the genius to make this happen. But there's no funding available because we're not talking about pharmaceuticals. We're talking about boosting the body's own ability to ward off degenerative diseases. So that money's not going to come from drug companies. It's going to come from interested individuals who want to see this technology evolve into clinical reality. So our Life Extension Foundation funds Dr. Maharaj and numerous other scientists who are making breakthroughs literally on a consistent basis against cancer, against atherosclerosis, against the most common degenerative disorders of aging. They're making these breakthroughs because they're approaching it in a different way than the pharmaceutical industry.
It's fabulous. How do people get involved?
People get involved with the Life Extension Foundation by typing Life Extension into Google, and you can find out all about what we're doing. But the research is also an integral part, and there are certain programs in which people can enroll as study subjects. They can actually participate in age reversal clinical research to see if they cannot obtain the identical benefits that have been observed in the animal model, where in laboratory studies, the animals are able to grow younger via the same technologies we propose to test in humans.
Now, are you doing these studies here in Florida?
Dr. Maharaj's clinic is in Boynton Beach, the South Florida Bone Marrow Stem Cell Transplant Institute. That's where the pilot study will be done on 40 to 50 elderly humans who will be the recipients of stem cell mobilized young plasma components. And we expect to see significant reversal of their aging process based on the laboratory studies done in animals and also some of the preclinical work we've already done in people.
Do you get any grants from the government?
We have a foundation called Stem Cell Cancer and Regenerative Medicine Research, Inc., which essentially receives funding to do some of the research we do. None of the funding that we've received so far has been from the government. It's been mostly, again, individuals or organizations like the Life Extension Foundation, which has a particular interest in looking at this type of research. So that's where we've had our funding so far. And of course, we want to get more funding because this is very critical work that we are doing, and we'd like to see it succeed.
Absolutely. So finding donors could help the situation.
We believe there'll be sufficient quantities of young donors who will be paid, by the way. These will be people who will be paid for us to mobilize their bone marrow in a way that we can then utilize the plasma components to rejuvenate elderly humans. And it's why the cost of the studies are high. The medications, the blood tests, the donors, all of this adds quite a bit of money. But this is a pilot study, and it means it costs a lot of money. Life Extension is funding the initial parts of this study, but we do need outside assistance to make it a reality.
Are there any sort of organizations, cancer organizations or other, that offer some sort of support, so where they have runs or other charity events that are assisting in this?
I wish there were. I wish there were more people interested. There are organizations dedicated to finding cures for aging, and they have a hard time raising money because the public hasn't yet accepted the fact that aging is a treatable condition. So we're at a very early stage of a medical renaissance where aging will be the target to eliminate. And once more the public and even the government recognizes that, I think a lot of funding will become available. But we're right now the pioneers.
You sure are. So what's available to people right now, Bill?
People who are suffering from degenerative disorders today have the opportunity for their own bone marrow to be mobilized in a way that they release their stem cells internally, which may have a significant beneficial impact on an underlying degenerative condition. So there are opportunities right now for people to go to progressive physicians and utilize technology, some of which was developed in the early 1990s. It's already been proven safe and effective, but it's not being used to treat the diseases of aging.
So where would they go?
At our institute, which is in Boynton Beach, the South Florida Bone Marrow Stem Cell Transplant Institute, we offer a variety of services for based upon the premise that if an individual's immune system is functioning normally, then what they should do is basically collect and store some of their immune systems through their stem cells for the future.
So you're suggesting that healthy individuals come in and store their stem cells as a prevention?
Yes.
That's one service.
That's one service. As a proactive intervention, proactive, prevented part of a wellness, overall wellness program, that's one intervention that they can do, which will basically solve many problems in the future.
People are limited enough, believe it or not,
Mm-hmm.
that if you don't specifically state their disease,
Mm-hmm.
they're not going to pick up the phone and call. So if you've just named 10 diseases that you can treat, the phone's going to ring for those people that associate with either they have it or a loved one has it or something else that's going to bring the traffic in.
One of the reasons why I'm not being specific,
Right.
is that basically our protocols are still experimental. But if you say, well, we can treat diabetes, or we can treat this, or we can treat that,
Right.
we're making claims which basically we are not allowed to do.
So Bill, what kind of diseases are we seeing breakthroughs in today?
A wide range of degenerative diseases associated with normal aging are being positively impacted when the bone marrow of the study subjects are mobilized so that their own stem cells are going to the part of the body that's dysfunctional. And what we're seeing is sometimes systemic rejuvenation. Let's say a person has a situation with Parkinson's disease. Well, they need a lot of help. So the mobilization of the stem cells in that patient's bone marrow is going to help with that neurodegenerative disorder, but it may also help with some kidney problems, from some heart failure, from other issues that are also going to emerge if they don't suppress them. So the interesting aspect of this type of treatment modality is it can help systemically restore their ability to survive, including boosting immune function and suppressing chronic inflammation.
So we're really talking about every kind of disease out there. I mean, we could potentially in the future change every sort of disease.
Chronic inflammation is an underlying culprit behind virtually every degenerative disease. We know that. And the way we try to suppress it with low-dose aspirin, certain nutrients, certain hormones, they have a minimal effect. They work, but not as well as we'd like them to work. By mobilizing our young components from our own bone marrow, we're putting out those fires of chronic inflammation, giving the patient an opportunity to heal themselves.
The Life Extension Foundation is the largest research foundation in the world. Tell us what you're expecting in the future.
Life Extension Foundation is the largest consumer anti-aging medical group in the world. There are companies that spend far more money than we do on research. We expend each year approximately $10 million towards a variety of research projects aimed at curing cancer, slowing aging, preventing premature death altogether. But that's all the money we have, is about $10 million a year. We need more than that in order to fund the research needed to reverse biological aging in elderly humans. So we ask for donations, we ask for whatever people want to look into to see where their interest may be. If they have congestive heart failure, there may be a program that we have that they can fund and perhaps benefit personally from the stem cell mobilization that goes on in their own body in response to some of the experimental treatments we might suggest.
So someone can actually fund their own part of the trial and participate themselves.
What's
and possibly
interesting,
healed or-
it appeared in the Wall Street Journal recently, the number of scientists who are doing self-experimentation, They're seeing age reversal occur in laboratory mammals. And they're thinking, why don't I try to put the same compound into my body? And they're doing it, and they're carefully measuring the results. And I look forward to seeing what the real reality of that will be.
So with more funding, with more research going on, what do you see in 5 or 10 years from now?
There's been some projections made that for a very small amount of money, $3 to $5 billion over the next 5 to 10 years, we may find a cure for aging itself. And unfortunately, the government is not prioritizing it, and a lot of charities are not. Certainly the drug companies, that's the last thing they want to see, because once aging is cured, then the demand for their drugs will probably plummet over 90%. So we need the public to pretty much revolt against the establishment and say, hey, we want a cure for aging and we want to participate, so please tell us more and we'll make a decision as to what we want to do.
What kind of response do you see from the public? Is it usually just people that are already aging or have disease, or do you see an upcoming new interest?
Well, interesting, when I founded Life Extension Foundation back in 1977, when I incorporated it, I thought older people might want to contribute money towards aging research. They didn't. We had to put out a newsletter in 1980, and then we started to attract members, and then we were able to raise funds through our newsletter and through other sales so we could fund the $10 million a year we're currently putting into research. But what's happened recently is the media is reporting on these successful laboratory studies where aging is being reversed in the animal model. And they're pretty much letting the public know, guess what? We're not too far away from humans benefiting in a similar way. So there is a growing public interest in the prospect of reversing biological aging, and the media is reporting on that in a rather favorable way.
It's very surprising that celebrities who have this kind of funding are dying from disease.
There are wealthy people who put zero into biomedical research, and that is regrettable. But then again, the founders of Google and Facebook, they're recognizing the fact that they're relatively young people, but they're not going to stay young forever, and they are pouring significant dollars into age reversal research. We're grateful they're doing it, but you can't put enough money into this kind of technology. In other words, more money, more different projects, that will increase the likelihood of clinical success.
How would people find you?
Our institute is it's the South Florida Bone Marrow Stem Cell Transplant Institute. We are on the internet. We're also, our telephone number is 561-752-5522. So just by searching the internet or calling us, they would be able to access us. Our website is bmscti.org.
Okay, and there's information about the current studies on your website?
Yes. Yeah.
Excellent. And what about you, Bill? How would people find you?
Life Extension is easy as just going into Google and typing in Life Extension. Again, we are the world's largest consumer-based anti-aging medical group. And I emphasize consumer because our objective is to bring the medical technology that's in medical offices literally around the world. But so many people just don't know about it. They don't know it exists. We introduce people who contact us to the most advanced technologies, be it a cancer center that specializes in a certain type of cancer. There's a doctor in South Florida, for instance, doing work with prostate cancer where he's able to selectively remove only the malignant portions of the prostate gland so that the male prostate cancer patient does not have to undergo all those horrific side effects. He's a unique individual. He's only available in South Florida. So people who belong to Life Extension, they are informed about doctors like Dr. Maharaj and others who are doing very unique medical procedures that's often decades ahead of the conventional system.
Bill, is there a certain donation amount that an individual has to give to Life Extension to become part of the program?
Not at all. Our website is open to the public. There's no passwords that they have to enter in order to access this information. We probably have millions of pages of information on that website, and if they use our search engine and type in a specific medical disorder, let's say prostate cancer, they can read free of charge all of the various recommendations we have to reduce the risk of developing prostate cancer, to treat it in a way that's less toxic than conventional medicine offers right now. There are so many breakthroughs out there that are occurring in individual physicians' offices, and the public is not aware of that. The doctors aren't advertising it. For the most part, they've got waiting lists of patients. But if you don't know about those doctors, you don't get the treatment. So people can log on to lef.org and they can find out perhaps a better solution to a chronic medical problem.
That's fabulous. You really truly are making a difference in the world, both of you.
Thank you.
And I'm honored to sit here with you tonight. Thank you so much for your time.
Thank you.
We appreciate the opportunity to get this information out.